Hi, I'm Alia Khan-Elhady, the lead clinical consultant at Biocidin, and today I have the pleasure of walking you through the full line of what Biocidin has to offer. Before we get started, I do have a disclaimer I want to share. The FDA has not evaluated statements or claims in this presentation. It's not intended to diagnose, treat, or prevent any disease and does not take away from the evaluation by a qualified medical professional. This is for educational purposes only. Any perceived claims that I make during the presentation are not on behalf of the company and are based on my own professional clinical experience. So let's get started. Biocidin has a curated line of 11 products total to support microbial balance and immune health. Biocidin Liquid, our flagship product, is a combination of 17 different herbs and essential oils. The beauty of using botanical when you layer them is they have this synergistic effect and are often better tolerated in a formula than using a solo botanical on its own. Biocidin is available in 7 different delivery systems to deliver the same base formula to different areas of the body. Once you understand the mechanisms of biocidin, you then reach for the application that best suits your therapeutic target. For example, if you wanted to concentrate your efforts in the gastrointestinal tract, you'd be looking at biocidin liquid or liquid fill capsules. If you're wanting to go systemic into bloodstream and lymph circulation, biocidin LSF, our liposomal solution. If we're wanting to support upper respiratory health, we have Biocidin throat spray and Megacidin throat spray. Or if we're wanting to concentrate our efforts in the oral cavity, we have Dentalcidin toothpaste and Dentalcidin LS, the oral solution. In addition to those 7 products, we have 4 support products that don't contain any biocidin, but are often layered into a protocol. GI Detox is a broad spectrum binder, really important to include when you're managing biofilms and managing die-off. Olivarix is our high potency olive leaf formula with additional drainage support for kidney and liver. Proflora 4R is our spore-based probiotic. And then Biotonic is an adaptogenic tonic. I'll go through all of these products in more detail as we go through each one individually, so you have a good idea of how to incorporate these products into your protocols. So how did Biocidin get started? It was back in the late 80s that Biocidin was actually developed out of a need. Dr. Rachel Fresco was approached by a handful of practitioners asking for a formulation that could support their HIV patient population with suppressing their pathogen load because their immune function had been suppressed. A handful of these doctors received the formula, and unbeknownst to Dr. Fresco, one of them actually sent it to Great Smoky's laboratory, which is now Genova Diagnostics. And she got a call one day asking what was in the stuff because everything they had put it up against, it was killing. So it went on a 6-year comprehensive diagnostic stool analysis panel where 250,000 stool samples were completed, and it came out being the most highly sensitive substance. From there, Biocidin was created. So what exactly is Biocidin? These are 4 main mechanisms of action. Biocidin is a broad spectrum antimicrobial, and it's going to help support the clearance of multiple organisms, whether it's yeast, bacterial, or even viral, which we've seen through clinical research, case studies or pilot studies. And from our clinical published research, we've seen with Borrelia how Biocidin has been effective with that viral species. In addition to that, Biocidin will help disrupt and dismantle the biofilms, which I think is extremely important if we want to have lasting therapeutic effects. Oftentimes, the organisms beneath that biofilm are not being addressed unless a biofilm buster is being utilized. So we might see short-term symptoms resolution, but not long-term success. We also know with Biocidin through our human clinical trial, we've seen an increase in immune modulatory activity. With just 1 single serving of the throat spray, we saw a significant rise in secretory IgA levels in the oral pharynx. Biocidin will also address inflammation through multiple activities. So first of all, it contains a handful of anti-inflammatory botanicals, antioxidants, but it also is going to help reduce gram-negative bacteria. And that gram-negative bacteria, its outer coating will excrete a metabolite known as lipopolysaccharides, or otherwise seen in the literature as LPS. When LPS is systemic in the bloodstream, we start to see systemic inflammation occur. And with using Biocidin, we have been able to see through preliminary research the reduction of lipopolysaccharides in blood circulation. So what exactly are biofilms? For those of you who are not familiar with biofilms, I'll give you a very brief introduction to help you understand why we need to address them when we're trying to sustain long-term therapeutic success. So biofilms essentially are communities of microbial cells surrounded by a polymer, a very sticky substance called extracellular polymeric substance, or EPS. It is an inflammatory endotoxin itself. It can be comprised of multiple organisms, aerobic, anaerobic, bacterial, fungal, as well as viral species. They are created very quickly. So within as little as 2 weeks, 80% of microbial infections can develop a biofilm. They're also extremely resistant to antibiotics. A bacteria biofilm can resist up to 5,000 times of its normal antibiotic concentration that it would need to resolve that infection. Biofilms in the gastrointestinal tract often contain lipopolysaccharides. And if we have any type of permeability, then those lipopolysaccharides can translocate from the gastrointestinal tract into blood circulation. We also see biofilms in other areas of the body, so they're not exclusive to the gastrointestinal tract. We can see them in the oral cavity. If we have any kind of prosthesis, implants, those are an opportunistic place for biofilms to create themselves. This was a biofilm study that was done at the University of Binghamton in 2013. What you see here are two different bacterial species. On the top, we have Pseudomonas aeruginosa, and on the bottom, we have E. coli. Both have controls on the top of the graph there, a control for its planktonic free-floating form of the organism, as well as that biofilm formation, typically more difficult to eradicate. But what we see here when we introduce Biocidin is very quickly, both of these bacterial species are dismantled in its planktonic as well as its biofilm formation. In addition to those bacterial species, we've looked at some yeast species. This is Candida albicans. At the very bottom of the slide here, you can see at 0 hours on the left-hand side, that green blob is a a Candida biofilm. Very quickly after introducing Biocidin into it, you can see at the first hour, it's already dismantled. Biofilms can be recreated very quickly. So we wanted to continue to watch it. And at 24 hours, it's still dismantled and does not reform. So really exciting data for us to be able to share with practitioners. So this brings me to Biocidin liquid. This is that flagship product. Biocidin liquid is my preferred formula for any type of delivery into the gastrointestinal tract. It's easy to titrate and you can use it with all age groups. Biocidin capsules might also be your preference if liquid drops are not preferred. Keep in mind 1 capsule equals 5 drops. So sometimes that's a little too much to start right out of the gates with. So I do prefer the liquid. I also like to coat the mouth and the esophagus, thinking about translocation from mouth to gut. So whenever we can cover our bases best, I go with that. You will want to take Biocidin before meals for best absorption. So usually I will recommend to my clients is when you are prepping your meal, it's time to take your Biocidin. So ideally 20 minutes before meals. We get this question asked all the time. If Biocidin is a broad spectrum antimicrobial, what happens to the beneficials? So of course we did our due diligence and we did a pilot study here, which we are actually in the works of recreating a human clinical trial that will be published in the future. But for now, I'll share this data with you. We had 13 individuals take Biocidin liquid and GI detox for 8 weeks at its maximum serving. 9 out of 13 individuals showed an increase in their probiotic abundance, which we thought would actually occur. So we saw the lactobacillus go up as well as the bifidobacterium. We also saw fecal bacterium presnitzii increase, which was extremely exciting for us to see because that is going to help with the production of short-chain fatty acids and butyrate. And essentially that's going to support the healthy lining of the intestinal tract. To our surprise, and it was a great surprise, we also saw Akkermansia ministophilia go up. And that's a keystone species that's a placeholder for all of our beneficial probiotics. And so when we start to see Akkermansia increase, we know that that's going to help with metagenomic richness, that diversity of our microbiome. It's also going to help with insulin sensitivity. So it was really exciting for us to see these numbers increase. So Biocidin LSF. This is the exact same ingredients as our Biocidin liquid. However, it's suspended in a sunflower phospholipid coating, a very small nanoparticle size, so it's going to have better intracellular uptake. In fact, in our Borrelia research, we learned Biocidin LSF has a 75% higher intracellular uptake over the liquid. So anytime we're wanting to go into bloodstream lymph circulation, Biocidin LSF is my preferred delivery system. It's also going to be better for topical application. And if you're working with any types of conditions where you need to get into the cell, then Biocidin LSF would be your go-to. Please keep in mind 1 pump of LSF equals 5 drops. So you might titrate this one a little differently than the liquid. Please refer to our clinical consulting team if you have any questions around titration. We also have references and resources on how to actually titrate up in chronic conditions. With acute conditions, I quickly go up to maximum because those are very short protocols. Ideally, you're going to take this one before meals as well. Sublingual delivery under the tongue, holding it for a good 30 to 60 seconds, and then swallowing. About 10 to 15 minutes would suffice for this one. This is some research that we did on Borrelia. This was done at the University of Jyväskylä in Finland. Dr. Leona Gilbert ran this study. It was a year-long study looking at all North American and European strains of Borrelia, all life cycles. So looking at spirochetes, round bodies, all the way up to the biofilm. And what she noted is both Biocidin liquid and LSF had a very similar cell death rate. So 97% cell death rate within 10 minutes. To her surprise and to ours, we also saw no apparent induction of the pleomorphic or persistiform, meaning that spirochete stayed in its most vulnerable state, allowing the botanicals to go to work. If you're interested in learning more about this study, please reach out to our clinical team. We have this published research, which we're willing to share with you guys. In addition to what I've mentioned here, I think I should also mention is we learned that the efflux pump is inhibited in this particular study. So Biocidin, we don't see a resistance being built up to this particular formula because it's going to inhibit that efflux pump. This is a case study of a little girl, 9 years old, with plantar warts. She did a 10-day protocol with Biocidin LSF. They would topically apply LSF directly onto her feet. She didn't wash it off. She wore socks to sleep. And then on the 10th morning, her little toes looked like this. So quite impressive. And I'm sure she was very happy to have her feet back. Biocidin throat spray. This is 40% Biocidin, 60% alcohol. The reason why it has alcohol is we're actually allowing the botanicals to dry into the oral pharynx. So this is really going to support upper respiratory health. In our human clinical trial, it was a single placebo-controlled trial with elite athletes. What we saw with one administration of Biocidin throat spray, which would be 3 sprays to the back of the throat for adults or 1 spray for kids, we saw within that 60 minutes a 66% rise in their secretory IgA levels. So quite impressive. If I ever find myself under the weather, I'm using Biocidin throat spray every single hour along with Olivirax. That being said, we recently introduced Megacidin throat spray into our line. And so with this throat spray, it's very similar to our traditional throat spray, but we've added in a couple bacillus spores that are known to help support upper respiratory tract health. As well, it's known to help prime our salivary defenses. So now that we have Megacidin throat spray, I like to use this one when I'm feeling under the weather, and I particularly like to use Biocidin throat spray on my day-to-day uses. It would be amiss if I did not talk about oral biofilms because our teeth provide a non-shedding surface for biofilms to accumulate. In fact, it's our only place in the body, unless we have implants or prosthetics, that allow for this non-shedding surface. So biofilms very quickly like to form in the oral cavity. It's otherwise known as plaque. One thing I want to note here is we have a lot of translocation from mouth to gut. So it's very important if we're wanting to have long-lasting results that we're also addressing the oral cavity. We do swallow 1 liter of saliva a day, and within just 1 milliliter of saliva, we're looking at 100 million microorganisms. So very quickly, what's going on in our oral cavity can be introduced into our gastrointestinal tract. For that reason, I love bringing in dental slide and toothpaste. People are already brushing their teeth, so it's a very easy product to bring into a protocol. It is a therapeutic grade toothpaste, so 20% Biocidin in a natural-based toothpaste. I use it with all age groups, toddler all the way up to elderly. You can use it daily, intermittently. Pea-sized amount is really all you need. This is my favorite toothpaste, and I do use it every single day, and I've used it for quite some time now, for a few years. If we're wanting more support than just superficial support, I would recommend pairing up the Dentalcidin toothpaste with Dentalcidin LS. This is our oral rinse and spit solution. If we're wanting to concentrate into periodontal pockets, if there's root canals, cavitations, periodontal concerns, then you definitely want to up the ante and use this in conjunction with the toothpaste. It's going to be very similar to Biocidin LSF, but we've added in some CoQ10 and quercetin, which are known to help support the oral tissue. Just like our toothpaste, we've got the clove and myrrh in there, which leaves you with a lovely oral scent, but also is going to help suppress that biofilm formation. Great for all age groups. Again, I like to use this with kids all the way up to elderly. In pilot studies, we've seen great clinical results within just 4 to 8 weeks of use. The way you use this one is 1 to 2 pumps in the mouth, swish it around vigorously for a couple minutes, and then go ahead and spit it out. No need to rinse. Dr. Rothschild ran this case study for us. He essentially was looking at 9 different individuals who showed an elevation of pathogenic microorganisms, both gram-negative rods as well as spirochetes in the gingival clavicular fluid derived from periodontal tissues. What he did is he had these participants use Biocidin LSF for a full month, swishing it around vigorously after meals. And what he found was 7 out of the 9 individuals had a significant reduction or elimination of the pathogens while using Biocidin LSF for 1 month. The reason why he didn't use Dentalcidin LS is we hadn't created it yet. In fact, this particular case study helped inform the creation of Dentalcidin LS. So now I'm going to move over to our support products. GI Detox is a broad spectrum binder. I think it's extremely important to be using a binder anytime we're managing biofilm and die-offs. It's going to help make the protocol a lot more comfortable for your patient. It's got some zeolite clay, activated charcoal, humic and fulvic acid, which is lovely for that pesticide absorption, some MMST silica, a little bit of apple pectin, as well as aloe. I like to use this one at bedtime if somebody's not taking sleep aids, or you can use it in between meals. You do want to make sure it's on an empty stomach, away from food, medication, as well as supplements. Olivarix is our high potency olive leaf formula. This has additional herbs in there to support lymph and kidney drainage. And I like to use it for seasonal wellness, as I alluded to earlier when I used the throat spray. You can use it in conjunction with Biocidin for additional support. I love bringing it in anytime there's an excess of gram-negative bacteria, really stubborn GI concerns, or even methane dominant SIBO, which we've seen in some of our pilot studies, which we are actually working on a human clinical trial with SIBO. So stay tuned for those results. Ideally, 20 minutes before your meals or with meals if digestive upset occurs. Biotonic is our adaptogenic formula. This has a combination of 2 ancient Chinese formulas, along with some additional botanicals, true to Dr. Rachel Fresco's form. She always layers in botanicals, as you will notice in our formulas. This has a combination of Liu Jingxing Tong, along with Bo Jung Yishi Tong, as well as Artemisia. So Artemisia is one of those botanicals that's known for being antiparasitic. So I love to bring it into protocols where parasites might be a concern. I also love using this particular tonic if there's any type of stress dysregulation. So if somebody comes in and they're fatigued, their digestion is off, their energy is really low, this is going to help support their chi and their vitality along with their digestion. So ideally, I like to use this one before meals to help support that digestive process or as needed throughout the day. Proflora 4R is our spore-based probiotic. Spores are extremely hardy, so they can survive really harsh temperatures, UV rays. They don't need to be refrigerated. And what you're taking is actually going to reach your intestinal tract. So quite important when we're looking at the CFU counts. We have 3 different spores here: Bacillus subtilis, coagulans, and clausi, pardon me. And so this one had, in addition to the spores, we also have 100 milligrams of quercetin. And quercetin is known to help reduce mast cell activation. So I love bringing in this in if somebody has a elevated histamine response that needs to be calmed down. There's also some marshmallow and aloe in there. So it's a very soothing capsule to the GI tract. Just 1 capsule is needed. You can take it anytime throughout the day and increase if needed from there too. I'm going to share one quick case study with you guys. This is of a 4-year-old female who was exposed to mold, as you see here on her Great Plains Laboratory mycotoxin panel. She has an extreme elevation of metabolites. So her practitioner put her on a 3-month protocol where she was using Biocidin liquid, GI detox, and Proflora. He also created a solution for her to inhale each night. And after 90 days, you can see all those metabolites get back down to 0, changing the trajectory of this little gal's life. Here's just a quick glimpse of some of the case studies we've worked on and the research that we've worked on. So if you do have any interest in learning more about them, please reach out to our clinical consultants. We're here to help you and to support you with your patients. As a quick reminder, chronic conditions, we do want to titrate, so please refer to our product usage guide. I like to retest around 12 weeks to make sure we've cleared everything we needed to. I love using our support products in conjunction with Biocidin. I see better outcomes and also more comfortable outcomes as well. Acute conditions, very differently. We're going to increase to maximum as tolerated, and those protocols tend to be a lot shorter. LSF, more systemic challenges, liquid and capsules, more for GI health, and then our throat sprays for upper respiratory support, and obviously our dental line, more for oral health. I'm going to leave you here with this information. If you do have any questions, please don't hesitate to get in touch with our clinical consultants. There's our number or our email address. You can order directly through biocidin.com, give us a call, or we are also available through most professional dispensaries. I want to thank you for your time and wish you well.